Bishop Taylor, members of Holston Conference, and guests, good afternoon. My name is Nancy Fitzpatrick, and I am pleased to present this year's report from the Holston Conference Board of Pensions and Health Benefits. In 2016, we made some significant changes to our health plans, consolidating to two plans, a PPO and an HSA. This restructuring was done because of increased medical costs and increased claims. We ended up 2015 similar to 2014 with large claims and had to dip into our reserves another $2 million. The changes implemented in 2016 are reducing claims cost. We apologize for being unable to publish insurance rates in the bound copy of the Book of Reports. However, we wanted to see some of this year's claims experience before setting the 2017 rates. The coverage options and rates for 2017 can be found in your handout. I believe folks were passing those out earlier, or on holston.org under the tab 2016 Journal. You will notice some changes in our health plan coverage for 2017. These changes will require all participants to make an election of coverage via mail beginning in October 2016 and running through November 30th, 2016. New for 2017 is a base plan under the Blue Cross Blue Shield S network and a premium plan under the Blue Cross Blue Shield P network. Coverage is identical in both plans. However, the P network offers additional providers. The P network will carry a higher premium because claims costs are higher on the P network than the S network. You will want to look at the Blue Cross Blue Shield list of providers to ensure you enroll in the proper network. This information is online at bcbs.com or will be able to be accessed through a link on the Holston website. Georgia and Virginia providers do not differentiate between networks, and this is important for all you Georgia and Virginia folks to understand. The S and P networks are unique to Tennessee. However, if you live in Virginia and Georgia, but you go to a Tennessee doctor, you will want to check the Blue Cross Blue Shield directory to determine if your provider is in the S network. If not, you may want to elect the P network. The church's portion of the medical insurance is increasing by 2%, which brings the total to $8,232 annually for each full-time appointment. The conference plan is self-insured, and Blue Cross Blue Shield continues as our administrator. Continuation plan and COBRA is available for continued coverage at the highest rates, 102% on the rate schedule. The insurance rates, as I said before, are available on the Holston website, and I believe if you didn't get one of the handouts, there are copies available at the front desk at Stewart. 2017 rates for the participants will differ based on the network you select. The S network reflects a 2% increase from 2016. The P network is a 10% premium charge above the S network rate. The reason for this change is that claims reimbursements are significantly lower for the same provider if the S network is chosen. This should save the plan money and help keep your rates low. We have a new requirement from the board for 2017. All participants and spouses, if covered by our plan, must have an annual preventive exam or physical between July 1, 2016 and June 30, 2017. If you do not have this exam, you will see an increase in your 2018 medical rates by $75 a month or $900 a year. And you may ask, why is this being implemented? Blue Cross Blue Shield advises that many of our participants are not having annual physicals. We want to catch medical issues early before they become a catastrophic claim to the plan, but more importantly, before they become a catastrophic medical issue for you. Effective April 1, 2016, the dollar limitation for bariatric surgery was removed. Another means of obtaining medical assistance with Blue Cross Blue Shield is available through Physician Now. This program provides in-home diagnosis by phone or internet consultation with a doctor. You may find this beneficial to use when you aren't in an emergency situation, you're having trouble getting in to see your doctor, or you're traveling. The doctors can treat common conditions such as sinus, rash, colds, flu, infections, those type of things. Use of this service can result in significant savings. Feedback from participants in other Blue Cross Blue Shield plans has been extremely favorable, but in looking at a report, I noticed we've had limited participation from Holston. So I was trying to get an example, and our Blue Cross Blue Shield liaison said, well, you can use me as an example. She just happened to use Physician Now recently, and here's what her experience was. She made a call to the doctor. The doctor called her back within 10 minutes. They talked for about 5 to 7 minutes. They determined she needed a prescription. He called it into her pharmacy, and all she had to do was go by and pick it up and didn't miss a beat at work. So you might want to check that out and see if that might work for you in certain situations. Additional information on this program can be found on our website.